Derick, thanks for joining me today. And it's been almost a year now that we've been working together, working on helping you with your neck and kind of a unique presentation of symptoms that you first came into the office with. So just tell a little bit about like your journey and what led you to start thinking your neck was the cause of a lot of your symptoms.
I originally started with having palpitations and through my heart, and that really led me into going to a chiropractor just because I had problems with my shoulder originally before anyway, stiff neck, things like that. And then as I visited that specific chiropractor, I noticed that some of my symptoms would actually be eliminated through those procedures. However, then throughout seeing him for a while, what happened was it actually got more aggravated and even worse. So I knew there had to be something with my neck.
Got it. So the heart palpitations had been bothering you for about how long?
The palpitations about 5 years. However, the heart issues or just the anxiety and different symptoms have been bothering me, as a lifetime.
Wow. Okay. So there was anxiety and different symptoms that were going on for your whole life, but the palpitations really started to kick up about 5 years ago. And you had probably been to cardiologists and other
Oh
doctors.
yes, for sure. Since I was 5.5 years old, all children's Mayo Clinic, all the way through multiple cardiologists, as well as therapists, counselors, other chiropractors themselves as well. Just so through the whole shoot, and then realizing now that it had everything to do with my vagus nerve and also having the nerves attached to my spine and being pinched by my brainstem.
Wow. What a journey. So during the course of going through all those different specialists, did you see that any of the therapies that they did with you really made a big difference? Or were you more still noticing that progressively you had a worsening of the symptoms with?
It was progressively getting worse for sure, and that's when the palpitations started, and that's when I really got started really worrying about the condition and how it was progressing. Just because now it's not just underlying anxiety, or when I was younger I had seizures, things like that, where I was manageable. It got to a point where I can't even work now because I don't know when I'm gonna have these heart, and it's not even necessarily heart palpitations. It's more of a shutdown of the system where my heart's not functioning correctly, something's wrong, and then I can't even work that day.
Wow. And all the tests that you had done, like echocardiograms and other heart tests, did they show anything significant?
No.
Okay. So you kept getting cleared by cardiologists and the other therapists and doctors you were going to, but your symptoms were getting progressively worse over time.
Correct. Right.
And so would you say that when you were growing up that you were already inclined to search for, I would say, more holistic types of approaches, or was this something that you had to do because you needed help and you weren't able to find it?
Oh, it's something I had to do for sure. Granted, I've always tried to look into a healthier side or a preventative side, and at the same time, it just got to the point where I've gone. The only thing that I can go to next is finding the last resort because I've went through everything traditional medicine had to offer, and then they couldn't help me.
Got it. So when we started working with you, Derick, we found that you had a very peculiar presentation of your cervical spine. And we'll show the image here in just a moment. But that curvature is what I call a boomerang curve.
Yeah.
And it's nowhere in the literature, but maybe we'll write a paper on it because it's really important to understand that Derick's neck had gone into a position of hyperlordosis at a few of the segments, where it was increasing the likelihood that your vagus nerve and other vital structures were getting impinged, irritated, blocked, the jugular vein, even pressure on your brainstem or the cerebral spinal fluid. And when we first found that that curve was really accentuated, what did that, how did you take that or interpret that?
I took it as it's going to take a lot of work, but we're going to put this back together so that way my body operates correctly.
Yeah, and you were doing pretty standard therapy to try to increase your cervical lordosis for a while, including traction and other things that initially gave you some results, but we found because we looked at an image of you, a year or two earlier, and then where you were at that point, and that the increased curve or too much lordosis was actually one of the main things causing your heart symptoms.
Right, correct.
And so we put you on a plan which was very unique in order to really first try to bring a taller and straighter cervical spine, and then to bring a natural, gentle lordosis in the lower neck. And, how has that journey been for you?
So far, it's been great. No complaints whatsoever. Just from moving forward throughout these months through this past year, all the symptoms have reduced dramatically. Because when I originally met you, I was diagnosed with diabetes insipidus, where not being able to absorb electrolytes. Being constantly dehydrated all the time. I went from that to now not even having to stress about drinking water all the time, things like that, and actually having a normal heart rate, and just not feeling stressed anymore, being able to actually relax when I sit still.
Yeah, that's really remarkable. And I know that the curve correction has been a very vital component of your rehabilitation. But it's neat because Derick is so inquisitive, and you've been so good at finding out exactly what works for you. And so now you were just telling me earlier that you have a combination of a daily dose of magnesium and also making sure you're getting potassium in your diet and still staying hydrated, but you're not as nervous, like, oh my goodness, I need to have water with me everywhere I go. And so the combination of doing the homework, you said you still daily do the neck exercises, take those supplements, and it pretty much has you back to able to fully do most of the things you love, would you say? Or
Oh yeah, correct, absolutely, everything. And not only that, now because I used to be an avid a gym member, and then that pretty much shut down over the past couple of years.
Yeah.
And then now I've been able to actually go back to the gym now, gaining muscle, gaining strength, feeling better, being able to actually go for a run without being afraid that I might have a heart attack.
Excellent. So
Yeah.
you're back at the gym. You're fully able to do your jobs. You're not as worried. You feel a little bit calmer, centered, with maybe still a few flare-ups here and there.
Right.
But you've really gotten back a lot of the things that make you feel like you're alive and that you're able to do what you love.
Yes.
Excellent. And so the first 6 months, I believe, when we went through your program, we knew that you had some instability, but the curve was so far off that we worked exclusively on the curve correction for at least 6 months before initiating any regenerative procedures, prolotherapy, and PRP. And with that initial program of the curve correction, we're going to show a few images of the beginning, of the middle, and where we got you to with the curve. But you said that got you to a certain point, and then the prolotherapy even helped maybe solidify some of the changes. Can you tell us how that progress went for you?
Oh yes. So like you said, the first 6 months at least was just nothing but every single day, 2 to 3 times a day, 5 minutes at a time,
Yeah.
just doing the neck exercises. That's huge. You have to be consistent no matter what you do in this, or it's not going to ever change.
Yeah.
And then doing all that hard work, and then just having those 3 prolotherapy sessions helped so much, because then I feel like it did help kind of cement in what all that work that I've been doing to help kind of tighten those ligaments to keep it there to where I don't have to, if I miss a couple of days of my exercises, I'm not stressing because I feel like I'm gonna have a flare up.
That's just great to hear.
Yeah.
And so Derick has been doing even more than 6 months of curve correction, because as you see in these images, the curve was really different than what normal should be. And there isn't really a prototype, or there isn't really a procedure that shows you when you have this really far forward lower neck and hyperlordosis in the upper neck, how to fix that. So Derick, in the office with Anthony, we actually worked on a plan that nobody else had ever done before. Do you remember the first time we're like, well, wait, maybe if we put a weight like this and then we get one here and then you hold yourself like this, that it'll really improve that curve, open the veins. And we tried it, and the first time that we tried that, do you remember you felt a lot different?
Oh yes, absolutely. My heart rate immediately, just the beating of the heart physically changed dramatically. That helped a lot. My blood pressure went down as well.
Yeah.
That was huge. And my resting heart rate as well, because my resting heart rate was so much higher than it should be, especially for my age. And then that's gone back down tremendously, down to 60, 65 versus the 75 or 80, which should not be there.
Well, it's a really neat story. So just to recap, Derick, we took your neck from really hyperlordosis in the upper neck, and your lower neck was too far forward. So anything that was just trying to create more of a curve was pushing you at this point into a further pathology that was exacerbating your symptoms. We found a unique way to pull your neck up and also to try to minimize that excessive curve, and eventually with the goal of restoring a normal lordosis. And you're really far away. You would say maybe that you're already 70% overall better, or how would you rate it just for everyone listening? Would you say 50 or 90%? Or What would you say?
90% for sure.
90%.
90%.
That's tremendous.
Right.
So, Derick's case has been a challenging one. The reason he's getting better is because he is consistent with his homework. He hasn't missed any of his appointments, and we've probably had maybe 12 appointments together, I would guess. It could have been 10, it could have been 15. But over this course of a year, we haven't had to treat you a tremendous amount. We've given you a lot of homework to do on your own, and you've been consistent, followed up with us. We've taken repeat imaging, which you'll see on the video here, and we're just so grateful you're 90% better. We're looking to take you hopefully closer to the 100%, and just knowing that you have strategies and homework you can do on your own to get yourself out of any flare-up really gives us a peace of mind, because we want to empower people to be well on their own, even though they may need us in the beginning. So is there anything else you wanted to share, Derick?
Just thank you so much. It's amazing that I was able to find you, and the videos that you put out have also helped me out tremendously with understanding what might be wrong with me, and being able to discuss, and all your time and effort and the care that you put in. It's helped out dramatically, because I know that if you wouldn't have done all that, then I wouldn't be here today.
Thank you so much, Derick. Okay.